Smart Moves is a progressive series of aligners that are less expensive, offer more control, and are customized to your patient's needs. Hi, I'm Bob Pantera, Technical Specialist at Great Lakes Orthodontics. In this video, we will review getting started with Smart Moves, case selection, estimating the number of corrective stages, materials available, and delivery. Smart Moves is designed to treat minor malalignments of the anterior teeth, including slight rotations, tipping, and spacing. Most aligner systems only move teeth up to 1/2 millimeter per setup. Smart Moves can achieve up to 1 millimeter of tooth movement per arch. Smart Move uses 2 aligners per setup for each stage of movement. The first aligner, which is made from a hard material with a soft inner liner, is the key to this dramatic tooth movement. It provides controlled, predictable movement, is easy to seat, and comfortable to wear. The second aligner completes the movement before the setup. Each aligner is worn approximately 2 to 3 weeks, meaning each set of aligners will take 4 to 6 weeks to complete the movement for each stage. Getting started with Smart Moves is easy. We will review case selection to help determine if the tooth movement your patient desires is achievable with Smart Moves. We will determine the number of corrective stages required, as well as what to send to the lab. And finally, we will discuss how to deliver Smart Moves to your patient. This is a case we recently received for Smart Move aligners. The lower arch has a bridge from 25, 26, and 27, which obviously we cannot adjust. 23 and 24 are moved somewhat facially, so we will retract these into the arch form to line them up with 22 and 25. The upper arch, while a little bit more involved, can be done with Smart Move aligners. To begin with, we will start on the lower arch, and we are going to measure the distance between the facial of 23 and the buccal surface of number 22 to determine the distance and how many aligners to use. Using our digital calipers, we will measure that distance. In this case, it is 0.86 millimeters, so that determines that we will use one set of Smart Moves to retract these anteriors. On the upper arch, we are going to measure from the facial of number 9 to the facial of number 10, which is the greatest distance for all of the 4 anterior teeth. In this case, the measurement is 2.29, meaning we will need 3 corrective stages to properly align these anteriors. This is another case we received for Smart Move aligners. As you can see, the movement is fairly minor, which makes it a great case for this type of system. On the upper, we are going to measure from the facial of number 8 to the facial of number 7 to determine the amount of distance. In this case, it is 1.26, meaning we will need 2 corrective stages for the upper arch. On the lower, we will measure from the facial of number 24 to the facial of number 23. This measurement is 1.30, meaning again we will need 2 corrective stages for the lower arch. So the patient will receive 4 total sets of aligners. This is a case where the movement desired can be achieved faster or more economically with an alternative treatment option. As you can see, there are quite a few rotations and crowding in the upper and lower anterior regions. If we decide to do a different type of appliance, a Smart Move aligner can be used as a finishing appliance to achieve the ideal result. Each corrective stage achieves up to 1 millimeter of tooth movement. With each stage or setup, 2 corrective aligners are provided. This is an example of the first hard-soft aligner that will be used. It is made from 1.3 millimeter material. The lining on the inside cannot be seen on the picture, but you can feel it with your finger on the inside. The second aligner for this stage is made from 1 millimeter material. This is the case that I had described earlier, where we were going to need 2 sets of smart moves on the lower and 2 sets of smart moves on the upper. And this is the final result of the setup we did. In this case, we did need to do interproximal reduction from the distal of number 6 through the distal of number 11, and also interproximal reduction from the distal of 22 through the distal of 27. In each case, you will receive a card. It will be blue, and it will have arrows indicating exactly where and how much interproximal reduction was done. 1 arrow means 0.2 millimeters per interproximal. 2 arrows would be 0.4 millimeters interproximal. If there was no interproximal reduction needed, it would be marked on the card also. If you prefer, send your case to our lab. We will evaluate the models, estimate the number of corrective stages required, and contact you with our recommendations at no cost to you. At this point, I would like to discuss the requirements needed for fabrication of the Smart Move aligners. You can either send a set of impressions for us to pour in the lab, or you can send a set of stone models that you poured in your office. Discuss the possibility of interproximal reduction and the cost per stage with your patient. Explain that your patient will be given wear instructions, and in addition to following the instructions, patient compliance is vital to ensure that Smart Moves achieves the desired results. Upon receipt of the box from the lab, please carefully unpack all of the contents. You will receive a duplicate copy of your original models, plus the reset models, plus all of the models that we made for fabrication of the trays. You will also have the trays in plastic bags, which are clearly marked for each arch and each stage. They will be sealed in the bag with the hard aligner at the bottom, the hard soft aligner at the top. You will also receive your stripping card, as we discussed earlier, along with any impressions or other materials that you send to us. Most appliances seat well upon delivery. Usually the appliance should seat well onto the teeth that were not repositioned in the lab setup. Initially, the appliance may not seat fully at the reset area, but over time as teeth move, it will settle into place. Aligner appliance wear should be full-time, except while eating, playing certain musical instruments, or contact sports. Patient maintenance involves brushing the appliance with toothpaste daily. Do not soak the appliance in mouthwash that contains alcohol. This could damage certain plastic or cause discoloration. Great Lakes recommends DentaSoak. Gentle, effective, and easy to use, DentaSoak cleans and destroys infection-causing bacteria in just 15 minutes. DentaSoak is non-toxic, alcohol-free. Feel free to contact us with any questions. Consult with an experienced technician if you have a question or would like to discuss appliance options. Our free consultation service can save you time and effort.